It's been nearly 2 years since the first person in Kentucky tested positive for COVID-19. And tonight, we're tracking some of the highest COVID hospitalizations yet. Let's first look at numbers from all across Kentucky. That line shows the number of COVID patients in the Commonwealth each day since last January. Tonight, more than 2,500 people are in the hospital with COVID. That's near the all-time high we saw back in September. And take a look at the last 5 weeks here in Louisville, where we've seen a record high. This month, Louisville's Department of Public Health and Wellness reported that 413 people here in Jefferson County were hospitalized on January 10th. And for a week, we saw that number continue to rise, with as many as 539 patients on January 18th. Tonight, nearly 500 people are still in the hospital with COVID-19. But if Omicron is believed to be a less severe variant, why are record amounts of people in the hospital? U of L Health's Chief Medical Officer, Dr. Jason Smith, says it's a matter of numbers.
It is probably less severe than Delta, but whereas maybe before you had 100 patients with it, now we've got 1,000. So even though it's less severe and you're less likely to be hospitalized, the denominator is so large that that's leading to the increased number of admissions.
While hospitals in the Commonwealth may be seeing a higher number of patients, what they don't have is a record number of people in the ICU. Statewide, here's a look at ICU beds filled each day since June 2020. Moving left to right, you can see people in intensive care spiked in January of 2021 and then again in September. On the far right, you can see that today there are nearly 500 people in the ICU, but in comparison to surges in the past, it is below the all-time high. Dr. Smith pointed out a similar trend here in Louisville.
I think during the previous peaks, we had somewhere between 60 and 70 in our ICUs alone. Now we're running 30, even though we've got, almost 100 or so more than what we were seeing at our prior peaks. And so it's not that it's mild, it's that you're just seeing a lot more people with it, and that's leading to people coming to the hospital.
We know that our hospitals treat people for more than just COVID-19, from emergencies to surgeries. But the ability to care for patients depends on how fast COVID is spreading. Here's a look at our overall capacity from across the Commonwealth. About 41% of hospital beds are available, but only about 13% of ICU beds are open. We'll continue to track all of the trends to give you more than just the numbers, but the context to understand what they mean for you and your family. In the studio, I'm Heather Fountain, WHAS 11 on your side.